Hello, I'm Jan Mold, Deputy Director of Competitive Events for Hosts of Future Health Professionals. You may have been having some discussions in your family recently about insurance. It may have been about car insurance, which for most teenagers is something they will discuss with their parents at some point. But we're going to be talking today about health insurance. Whether you go into a health career or not, you're going to be a consumer of health career services. So this is some information that will be important for you to know. I wanted to talk a little bit about the cost of health service because I think sometimes we don't realize how much we spend. 17% of the gross national product is spent on healthcare services. It's growing faster than any other cost of living. In the United States, there are two main types of insurance, public and private, and we're going to talk about each of those. Insurance that is funded by public funds is from the federal government. Some examples are Medicare, Medicaid, Children's Public Insurance Program, and Veterans Health Benefits. And I'm going to go into more depth of each of those. Medicare was enacted in 1965 and is insurance for those over the age of 65 and younger folks who've had a disability for 3 years or greater. In 2021, nearly 63.8 million U.S. citizens had Medicare coverage. Medicare is always primary, which means that if somebody comes in and they have both two insurances, Medicare is always billed first. The types of Medicare include Type A, which pays for inpatient hospital coverage, Type B, outpatient medical coverage, Type C, Medicare benefits through private insurance, and then Type D covers prescription drugs. Medicaid, again enacted in 1965 at the same time as Medicare, is health insurance for low income. Each state receives money from the federal government to run their Medicaid program. In some states, it's called Medicaid. In other states, it may have a different name. For example, in Tennessee, it's called TennCare. The Children's Health Insurance Program, called CHIP, goes hand in hand with Medicaid. It's funded jointly by states and federal governments. In 2021, 38.3 million children were enrolled in Medicaid and CHIPs combined. Veterans Health Benefits are insurance benefits for those that have served in the military. When we talk about private insurance, that's either obtained from your employer as part of a benefit package, or you can purchase it individually. There are three types I'm going to talk about in a little more detail: health maintenance organization, point of service, and preferred provider organization, which can be a tongue twister. For a health maintenance organization, the insured pays a set fee and receives medical service from a physician and healthcare professionals and facilities that are owned by the health maintenance organization or employed by the health maintenance organization. It does not pay if you use another network of physicians, so your choices are limited to those that are within the health maintenance organization. A point of service is where you have an in-network physician who's designated as a primary physician. You don't go outside of the network unless you're referred to a specialist, but will pay, and if you go out of network without a referral, you're going to pay most of the cost. A preferred provider organization is usually through industry or large companies to employees. It's restricted to certain doctors and facilities, and you'll have a list of those people you can use. Again, if you go out of network, the cost is higher. All of these private insurance run on what's called a managed care program, which means that somebody's the gatekeeper to make sure that services are not overutilized, that people aren't seeing specialists without a specific need. Some terms that you're going to need to know. Premium is what you pay to buy coverage. So that is the cost. Deductible is the amount that you have to pay before the insurance begins to pay. And you may have heard your parents talking about a deductible on your car. If you're in an accident, if you're hurt, then you have to have that money up front before the insurance kicks in. Coinsurance is a specific percentage that the insurance and the insured share. So if your co-insurance is 80-20, the insurance company pays 80% and you pay 20%. And those co-insurance percentages will vary. Co-payment is the amount the insurance pays at a time for a given service. So let's say you go to your family doctor and your co-pay is $50. That means you'll pay $50 on the day that services are rendered. I hope that explains a little bit about insurance. Your teacher will have some more activities for you to participate in. I appreciate your attention.